Hi, this is Dr. Cadwell, and today what we're going to discuss is we're going to talk about our functional approach to care, functional approach to health care. Probably every day we get someone that comes through our doors that is frustrated because they've tried multiple things or they've done multiple things to try and resolve their health challenge. And what we begin to find out in our conversation is, yes, they've tried several things, but most of those things have been very symptom-oriented. And so what I want to help you understand is the same thing I help them understand, why they're frustrated, why they're not seeing any sort of long-term benefit or any, necessarily benefit immediately, period. So what we do here is we're going to approach your challenge or anybody's challenge from what we call a functional perspective, okay? So very simply, when someone comes through the door, we want to look at how the body is working or not working, okay? So we'll break it down into two categories to keep it very simple. One is going to be the structural side, or what we would maybe call the sort of neuromusculoskeletal system, so the mechanical side of how the body operates. The other side can be what we call organic function, how the body is working internally, liver function, digestive function, thyroid function, adrenal function, reproductive organs, pituitary function, those sorts of things. Now, the key to you feeling well, to being healthy, to getting out of bed feeling vibrant, being able to do the activities that you like to do day in and day out, to be able to go to work, to be productive, play with your kids, both of these systems need to be working. They need to be operating together, right? So they're interdependent upon one another. So in other words, you don't see a bunch of livers walking down the street. You don't see a bunch of skeletons walking down the street. They need each other in order to operate, right? So when we talk about function, what we want to evaluate with people is we want to evaluate what's happening on the structural side. Say if someone comes in with back or neck pain, are things working mechanically in the right way, or are they decreasing in function? Same thing on the organic side, liver function. If someone's having a blood sugar problem, it's not always the pancreas. The liver could be involved. There could be digestive issues involved. There could be thyroid issues involved. It comes down to assessing functionally whether the organic side of the body is working appropriately as well. So imagine this, that you start to see a decrease in function somewhere in the body structurally, or you see a decrease in function somewhere in the body organically, or you see a combination of those things happening in an individual. In other words, they're seeing mechanical dysfunction and they're experiencing organic dysfunction. Well, very simply what you can assume is that over time, depending upon how long that challenge has been there, as the whole body, as body function begins to decrease, the body will start to manifest or create these things that we call symptoms, okay? And the symptoms are no different than the check engine light in your car. If the check engine light comes on, I would guess that the majority of you are probably going to take it somewhere to figure out why that check engine light came on. You're probably not going to just go cut out a piece of cardboard, tape it over that check engine light, ignore it, out of sight, out of mind, because you and I both know that there's a reason that that light came on, and if you ignore it, it's probably going to turn into a bigger problem. Well, I'm here to tell you that most people, as it relates to their health care, whether it's a mechanical problem or an organic problem, are just covering up the check engine light. What's happening is they're going to a place with these symptoms. So they have a problem, they have a challenge, and they're feeling it. Okay, let's say let's say back pain, sciatica, numbness, tingling, neuropathy, whatever it may be. They've got something going on. They go to somebody and they present with these symptoms. Whoever that healthcare provider is that they see usually gives them some sort of diagnosis. And that diagnosis is a oftentimes fancy named condition that makes no sense to the person that's suffering with it. Once that diagnosis is made, then usually that person is prescribed some pills. They might get some injections. They may be told to go to physical therapy. And if those things don't work, then they've got to go get surgery is what they're told. So when I sit down with somebody, or we sit down with somebody here, we want them to know that obviously we want to help them to avoid that, for sure. And if they've already had a surgery, we want to help them avoid a second or a third or a fourth. So that's something that we don't want to, we don't provide here, number one, but we want to help a person avoid, okay? Physical therapy in a mechanical situation is not a bad thing, okay? The problem in most of these situations, because we get multiple patients that have come in and said, well, I went to physical therapy, but it made me worse, and it doesn't work. And I tell them, listen, physical therapy is a fantastic tool, and it's going to most likely be a very necessary part of your healing and getting well. The problem is that it's been done too early in the game, okay? So I tell them, imagine baking a cake. It's like baking a cake and frosting that cake before you put it in the oven. It's the right thing to do, just the wrong order. You've done it in the wrong order. So physical therapy is not a bad thing. It just needs to be done further down the road once we've assessed functional loss and begin to improve that functional loss, okay? So this needs to be eliminated on the front end in most cases. Not all, but in most cases it does. Pills and injections, nothing wrong with those things, okay? You know, we do med management here, we do injection therapies here. The deal with these is that they're primarily designed to help get the fire out. In other words, help you to begin to feel better, okay? No one likes to be in pain. I understand that completely, so we want to help to eliminate that pain. And we can do it in very targeted fashion based on the types of treatments that we provide. However, what happens to most people is this is where they stop. So they get sort of sucked into this symptom-chasing model, okay? In other words, they're not fixing the problem. They're not figuring out why the check engine light came on. They're just doing things to turn it off because it's annoying, okay? It's something, and so this can provide some relief, both of these things, and it may provide relief for a short period of time. It may provide relief for a long period of time. But the reality is if this is all that's ever done with somebody, then eventually the medications wear off, or the injections wear off, and they still have the problem, and frequently that problem is worse because they've been going about doing their activities with a existing functional problem, not feeling it, not sensing that there's a problem, and so it progressively gets worse and worse and worse. And this is how a person ends up in a chronic pain pattern. And eventually the medications don't work anymore, or they have to go to more powerful medications, which have other sorts of challenges and effects associated with those, and it becomes somewhat of a downward spiral. So we want to help not only get a person's symptom relief, so we want to help you to get better and feel better. That's important. That's vital to your healing. That's vital to your well-being. But we want to actually, as we begin to help you feel better through symptom-based treatments, we want to come down and we want to identify functionally why are you having the symptoms in the first place, okay? And then once we determine that, we start to integrate what are called functional-based therapies, okay? Things that start to improve mechanical function or start to balance out metabolic or nutritional deficiencies. So that's how you start to fix the problem. So as function increases, as things begin to increase, obviously, and they begin to work better, and we get a flipping of this arrow where we have increased function, then what happens is the check engine light goes off, the symptoms go away, and so does the long-term need for these symptom-based therapies. Now, when we get to this place, that's when we start saying, let's get back into PT, physical therapy. Let's start strengthening that core. You're going to be able to handle those exercises now. You're going to be able to get out and start walking, which is going to help you to lose weight and do all these other things that people want to do that they're unable to do when they come in with these chronic situations. So this is a very simple explanation of what it is that we do. But it doesn't need to be any more complicated than this. You just need to identify the functional loss as it relates to mechanical or organic dysfunction, help to alleviate or diminish symptoms, go to work on fixing these issues, and before long, you're feeling better than you've ever felt in years. So thank you. Call us with any questions. If you'd like to find out if we can help you, just reach out, call the office, and schedule a free consultation with one of our providers. Thanks. Have a great day.